Julien Salaberry, co-founder of Galen Growth Asia. Gillian Tee, co-founder and CEO of Homage. And moderating this session is Carolyn Ng, Vice President of Vertex Ventures HC. Let's welcome them on stage.
Testing. So good morning, everybody. Thank you for coming to the health tech session. It's probably one of the rarer ones, I think, within these whole the quite a tech-centric focus Echelon Summit. So it's great to see the health tech represented here today. So I think that sort of brings me very naturally to sort of first topic that I'd like to engage our panel speakers on today is why healthcare? I mean, clearly, Nawal and Julien you guys all have pretty broad skill sets and not typically, scientific or medical background, but it's, sort of brought you into what you're doing right now, just clearly, very healthcare focused. Would like to really love to hear your thoughts on how you come to this journey. So maybe we'll start with Gillian.
Sure. So I think for me, I moved back from the U.S. about a year ago to Singapore. I started a previous company in New York and in Silicon Valley. And what really excited me about my first business was the fact that it improved the livelihoods of people. And so there was this element of helping them grow a second income. So my first business, Rocket Trip, which we grew to profitability, helped businesses save in business travel expenses by rewarding or paying the employees for doing so. So it was the carrot versus the stick. Employees loved us because they could pay off their mortgages while reducing the extravagance of business travel. So that aspect of a business really excited me. So when I came back, I think it was a very personal decision. My mom was 70, and I was getting a little nervous because I started realizing that she was driving a little bit slower and she was starting to forget things, and so being a little bit more forgetful. She's very healthy, but I started to be nervous. So it was a very personal decision for me to combine sort of looking at solutions for providing better senior care to this element of job creation, of making sure that people were growing second incomes. And so I was very excited about job portals. I was excited about education. I was excited about health. But the two elements just came together very nicely to, I knew that we needed to expand the caregiver pool in Singapore to, we knew that it was a matter of time. It was not a matter of if, but when. 1 in 4 people in Singapore would be 65 and above. So, it was it was either I was going to work on it or somebody else needed to work on it. So it became a very natural thing. I think for health companies, particular, in my mind, is very much, I think it becomes very personal. So it's a very, personally driven experience. A lot of the healthcare founders that I know have family members that they've, dealt with ailments themselves or conditions themselves.
Sure. Nice to hear that there was a sort of a personal backstory to that. Nawal, was that also something that that you picked up on the demographics or the market opportunity, broadly the healthcare sector?
No, for me it was very personal. Midlife crisis. I was getting I was getting old. I had fairly good success in finance, and it was not turning me on anymore. And I wanted to do something that has an element of economic good, but at the same time social good. The narrow word for that is impact. So if you really look at it right now, certainly the amount of impact that we are able to create is significantly higher. But if I switch on my finance hat, I would also say the ROI on each dollar invested is also significantly higher if you think purely as an economic entity.
Sure.
So for me, it was more around that. I mean, I think a certain degree of maturity, a certain degree of frustration with finance, a certain degree of wanting to do something. And the only two sectors that was appealing to me was healthcare and education. I couldn't find anything interesting enough in education to do. And I bumped into something, a few ideas into healthcare, and that's why I started in healthcare.
Great. And what about you, Julien? You probably actually are a veteran over here, having led M&A acquisitions back in the early days, even within the large pharma, and you I think stayed pretty true to your healthcare track here. What's your journey been like moving from that side of the buy side to currently being an investor and helping to build these companies?
Sure. Thanks, Carolyn. So yes, I've been in healthcare really pretty much all my career. So roughly speaking, close on 20 years in total, where I've worked for some of the largest medtech and pharma companies in the world, and I've worked for them in Europe as well as in Asia. I've been in Asia for about 15, 16 years, working for large corporate for a while. But what I started learning in large corporate was that not only was I being constrained by the straitjacket of corporate strategy, and I mean that in a positive way, you have to have a strategy, but I was also discovering that there were two issues lying around in my head that I wanted to resolve. And it's about 5-6 years ago when I changed my journey. One is that if you look at the amount of investment in R&D in biotech over the last 80 years, the productivity has dropped off year on year on year, which is an inverse correlation to the amount of money that's gone into it. Therefore, no matter how much money you throw at the problem, you're not solving health. And the other thing that I was very aware of is that in Asia, certainly, the disease burden was growing. So the more affluent people were getting, the more the disease burden was growing, particularly chronic. And therefore, sitting within the large pharma company, doing M&A, JVs, selling products, buying products, etc., I was increasingly conscious of the fact that I wasn't actually helping the disease issues and pain points of healthcare in Asia. I was just perpetuating the same model to the same set of customers.
That's right.
And so I really started doing some bits of soul searching and looking at what could I do that would be different. And then that was really beautiful for me because I was doing that same set of questioning to myself at the same time as that inflection point in medicine. What we're going through now in medical research as well as disruption in healthcare, which is what we're talking about today, is really taking a massive turning point at the moment. And so what you're seeing really across the entire value chain of healthcare is a massive change from clinical trials to the way in which we're curing cancer to the way in which each one of us in the room is being able to start taking much greater ownership of our health. And that trigger was kind of, well, now's the time to step out of the large corporate and have a go at doing something else, be a catalyst in some other way. Which is why I stepped into the investor shoes, really, which is, okay, so how do I recognize the talent, the potential of an invention, and try and put the right amount of gunpowder behind it to actually allow that invention, that talent to make a difference?
Sure. Great. I think that's a great segue into, I think, what we're going to touch on today more broadly. It's disruption in healthcare innovation. And I kind of want to come back to Nawal a little bit on this. So Nawal's Hallmas is a chronic disease management platform that actually has 3 different therapeutic areas that it covers: diabetes, cardiovascular, and mental health. Obviously very large, social issues and burden with these conditions. When it comes to disruptions, it's almost like I think it's sometimes I'm sitting in the investor side of the table. People say, "Oh, not again, not another diabetes company. Not another AI data analytics platform." It seems like we are seeing increasingly a flood of these companies in this space. So, Nawal, how do you think Hallmas is differentiating itself really within this increasingly crowded area, and how are you seeking to disrupt, I think, the system in a way that some of the other incumbents or even emerging platforms are doing?
Absolutely. First of all, an extremely beautiful question. But if I were to take the answer to that, I would say we can have another 100 companies doing diabetes, and still the problem is so bloody large that we won't be able to solve it. That's number one. Number two, there is a lot of posturing going on. So there is anyone with a basic app with a simple weight loss program claims to be a disease management program. And hence, if you find under the hood, there is really nothing, but it's a huge marketing campaign to be a disease management program, but there is really not much service to offer. Okay. What we are looking for is the way we differentiate ourselves is, one, we are building end-to-end, using the tech term out here, full stack of chronic disease platform. And within that, our starting point is diabetes, but the intent is to cover major 5 or 6 disease, which are the basic 60 to 70% of healthcare cost for any macroeconomic variable, be it at the country level, be it at an insurance company level, be it at an employer level, whatever verticals you choose, you really find that these 5 or 6 major disease are the killer, at a very macro level. On top of that, if you go deeper into it, what you really find is many times we are not really solving a clinical problem. We are solving a macroeconomic problem. Okay, it means I can literally tell you in Singapore itself, you can have 5 another hallmarks, and still we won't be able to capture the market. Okay, and so I personally will love to have more guys coming into it.
Sure.
Literally make the competition more intense, but also this will filter out every posturer in the market, and that is what will happen over the due course.
That's right. I think that's what we're starting to see right now in the industry as well. There's a slight consolidation in that part where some of the lesser platforms are dropping out of this race. And for Homage, which is interesting because I don't know, Julien actually was sort of describing Homage to me, and I thought that was interesting that he positions like sort of Uber for home care. So it's almost like an on-demand type service for elderly people to sort of get home care as and when they need, and it's quite an interesting model. But at the same time, that these days again we're talking about Uber for everything. Uber Eats, Uber for for Tinder and all sorts. So again, how are we doing something realistically different here? And how do we apply some of these tech trends, say the Uber or something, into healthcare? And in that way, are we really disrupting the model, or just would like to hear about how you come around thinking about the model that you're applying for Homage?
Yeah, I think that's a really good question. There are quite a few pieces there. I think it's really important, just to touch on a few points that Julien brought up. There is a change, a redefinition of what healthcare means. I think people are starting to realize, particularly to providing healthcare for older adults, what does it mean to redefine wellness and well-being, right? So a lot of the needs, a lot of the problems actually is not non-medical. Sure, there is that medical component, there is that chronic component for sure, but what we're seeing is on the ground, particularly, it's important for healthcare companies to, first of all, understand that it's not just a matter of inserting an IoT or throwing technology at a problem, but really understanding how technology is that enabler to the bigger part, which is what is the best kind of healthcare? What is the holistic definition of, whether it's social psycho or it's medical, it's clinical, it's chronic. What does that holistic end-to-end type of healthcare mean? So for us, I think for Homage, we see technology as as an enabler. So it does. So the Uber for healthcare, I mean, that's a buzzword, but essentially Uber, if you think about Uber, it's a logistics company, right? So if you can, in any way, shape, or form, make the logistics part of community-based or home-based care better, then that's doing something right. So you remove, increase accessibility, you reduce, increase visibility into the caregiving process. I think nobody is going to wake up in 10 years and go, I wish for less accessibility and less data and less visibility into the care that my family is having.
Sure.
So, yeah.
So just juxtaposing tech and healthcare. Now, I think that now today we're really focusing on, talking about health tech, which is sort of, the merging of technologies or tech in a broader sense with healthcare. Julien, what do you think are some of the sort of the key defining factors that truly differentiate, say, the health tech sector from, your more general or other types of technologies companies? What are some of the trends that you've seen in the sector and or characteristics that truly define these early stage companies in terms of the kind of journey or experience they have as a company versus the other type of tech companies?
It's a big question, but one that's actually incredibly relevant at the moment, and one that we, again in growth, and I'll say a bit more about that in a minute, are trying and solve as part of our mandate. So health tech, it's an interesting term, and let me help you understand what we mean by that generally. So we're not talking about biotech here, so I'm excluding from the conversation anything as vaguely molecular, chemistry, synthetic biology, very exciting areas, but I'm excluding that from the debate today. I'm excluding from the debate medtech, so we're not doing any hip replacements, we're not talking about pacemakers, we're not talking about anything that's implants that is FDA regulated at a class 2, class 3 level. Again, it's a separate category. I'm talking about health tech, and I guess the fundamental two drivers of health tech for me are the fact that we have much greater access to data, the first one, and the second one is that the barriers to entry from a cost perspective of trying to make a difference in healthcare are dropping very fast. So it's a mixture of, I guess, what I call the Moore's law of medicine, which everybody kind of scoffs at. But if you think about it, the actual price point of being able to get into medicine and make a difference is dropping fast for various reasons. And so you take an example, DNA sequencing, when Bill Clinton launched the program officially back in '96, I think it was, I think it was somewhere in a multi-million to sequence one individual. We're now doing that for just under $1,000 per individual. So this will give you an idea of the Moore's law side. Now, what does that mean? That essentially means that each one of us is able to more or less define the computer code as driving our body. Now, the beauty of that computer code, there are 5 times more fail-safes in it than there are actually instructions. So it's a much safer computer code than most of the computers we use. But the beauty of being able to understand that computer code means that we can start making a difference. And the same goes some of the other data we are retrieving using our hand phones, for example. So that's very exciting, and that's what I mean by that sheer inflection point that exists in medicine at the moment and what we can do with it. And the fact that we all have a handheld phone in our hands means we're collecting data, but also means that you're able to access a different audience very differently. Now, it is different when you are a health tech player versus a tech player, to come to your last question. And most investors struggle with that, particularly in this part of the world, because you cannot take your due diligence approach to a tech business and apply that to a health tech business and end up with a correct, appropriate investment decision. You've got to go beyond that. And one of the big ones that is often ignored is the requirement to comply with regulations. It's a hard space to comply with in health tech simply because it's a pretty fluid space. The most advanced regulator in health tech is the FDA, and they are setting a fairly clear precedent, and Singapore is following. So they released their telehealth guidelines a couple of years ago, for example. So the way an investor should look at it is always make sure that you're consulting the right experts, be it looking at the science, looking at the market, but also look at the regulation side. Because what you don't want is a government switching your whole business to zero because they've decided to change the rules of the game. It's happened in China a couple of times already. Right. And in India it may happen soon with the script fulfillment business, for example, depending on how much the private pharmacists complain to the government. Mm-hmm. So it depends how populist the government is, I guess. But the general advice to any health tech entrepreneur out there is be as compliant with healthcare regulations as any drug maker. It'll cost you in time, it'll cost you in consultants to get it right, but you know you're the right side of the line.
Sure, thank you. I think that's
if I could add, the way to visualize is the traditional healthcare delivery model is more of a hardware business. Health tech, as we are talking about, is more of a software business. Okay,
that's right.
That will be the key differentiator.
Right.
If I could add to Julien's comment, we can certainly have more of Uber of healthcare, but let's not have too many Kalanick of healthcare.
Sure. So, speaking of the regulatory barriers that truly differentiate, I think, this sector and set the barrier so high, I think, in a way where you think about starting your business, I think there's also implication clearly on the capital requirement, because in order to comply, you would probably need to build certain infrastructure, or there will be additional procedures that will be required. So when it comes to fundraising, and then I think Julien also brought in just an excellent point about how our local investors or regional investors in this part of the world is really also coming to terms about how do we look at health tech right? Do we need healthcare professionals to look at this, or do we need tech professionals to look at this? Nawal, what's your fundraising experience has it been like? Have our investors, like myself and the others, who are also obviously seeking to learn more and more about this space, how are we actually coming up to speed fast enough to actually understand, what you're trying to do with Whole Mask?
How much time do you have?
As much as you need.
you want me to give? Let me. I understand the health tech as a sector is moving at a fast pace. The number of entrepreneurs in the space is far, far greater than number of investors. On top of that, the metrics that they are looking at is all the wrong metrics. Okay. And hence, I would say, as of now, we really don't see some serious risk capital and growth capital into health tech as a sector. Okay. Having said that, it's changing dramatically. I mean, if you read the industry reports, what you find is a typical health tech exit is at least 50 to 80% higher than a tech exit. What it means is you will see some serious major ROI trade-off into health tech, and that will hopefully wake up a lot of investors to really go deeper into this sector compared to e-commerce, fintech, and things of that nature.
Sure.
So a simple dollar invested in e-commerce will not give you the same exit opportunity as much as it will give you into health tech. Even if you fully discount the impact, okay? Even if you purely take it as an economic point of view, it is still, in the coming years, I would bet that the health tech investment will be probably one of the largest bucket compared to anything else if you take it on the risk-adjusted basis. But as of now, it is a serious drudge. Raising money for health tech is not easy. You literally become a professional beggar, to survive.
We all are in different ways. Gillian, what about you? You have successfully, I think, raised close to 2 million now from GGA and Jungle Ventures and 500 startups and some other groups. What has been that experience? What's that journey like? Actually engaging on these some of these investor groups on a company like yours in the health tech space.
Yeah, it's a little interesting. It's been an interesting experience. Just fundraising in Silicon Valley and in New York is a very different experience than fundraising in this part of the world. I have to say that the gap is getting closer. So in the U.S., you're looking at sort of what kind of benchmarking data do investors have, right? You're looking at 10, 20 years. Most of them have that sample size as well. And here it's a little bit more nascent because the market is very, very nascent from all parts of tech, not just health tech. So I think with Homage, the experience has been, there is a lot of, I think as Nawal mentioned, there is a lot of speculation interest. I think a lot of them come at it as, how big is the market? What is the addressable market? And that's been the predominant discussion. We've centered a lot of our investment discussions around market size. But, one thing that I think, even after we've gotten the investments, we've been asked to look at and perform due diligence on other health tech companies just because we were in the health space, I think just goes to show that there is still a lot of figuring out to do. In this area, and one of the things that I found was it's very different from market size to adoption. So, I think Julien mentioned very well in terms of the different areas that you have to look at. I think one of it is really what is happening for that particular market on the ground, and I keep using on the ground because, for example, IoT is everyone knows, right? So AI, IoT is the next big thing in health tech. But if you look at the ground and what is the adoption rate actually of families using IoT devices for health, and you know that there is that hurdle, there is that barrier to entry for a lot of these companies, and that applies not just in Singapore but across the entire Southeast Asian region. So I think you have to look at very closely at if you're an entrepreneur trying to move into health tech, you really have to understand what some of these barriers are and what sort of distribution channels you need for particular is very niche health tech products. So for us, for Homage, and I can share a little bit, I think what we look at very carefully is, in 5 to 10 years' time, what does healthcare for seniors look like? So, there is this huge push of home care back to the community, back to the home. That concept is still very new. So my first business, I remember just people thinking, using rewards and gamification for business travel. It took a while for sort of the tipping point. It took about 4 to 5 years for people just go, this is a good option. This is a viable option. It's now becoming a mainstream option. And I think it's the same thing for home healthcare. So, getting people to understand that it's not just a nurse showing up with, a syringe and injecting you because it's, people have that conception of home care. So we are pushing up against this whole new understanding of landscape of what it means to be in health tech. Yeah.
So just to capture a few themes here, so clearly it's a futuristic space, so to speak, both sides of the table are learning. Julien, what would you recommend, I think, to, having you are also an investor and also working with a lot of these companies to help build them and fundraise. What would be sort of correct approach or angle when they come in to pitch to, say, an investor group that's not necessarily, say, perhaps, not extremely well-versed or experienced yet, I think, with the whole health tech sector? What do you think is usually the positioning that should go in? What's the right approach to just even get this discussion started, to set the mindset right? How do we help them see the opportunity here?
You're talking from an investor perspective or from a startup perspective?
Yeah, so how would you coach these entrepreneurs or companies, early stage companies, in their approach to the investors, which will be part pitch and perhaps part educational? So what would that approach be like?
It's a tough cue, and I suspect it's one that probably needs to be directed more so to these two in terms of they've had the education of the investor. It's a very good question because the lion's share of investors in this region who are even sniffing at health tech are crossover investors. So they do a bit of dabbling in health tech alongside other verticals. So they generally will employ their normal approach to investment decisions and due diligence than they would across most of the verticals. So if you're a health tech entrepreneur, it's the usual rules of the game, really. I mean, you should look at it as being applying for a job, which means that you're going to kiss a lot of frogs before it turns into a prince. But be mindful of the fact that you should really do your market research and your segmentation. What I mean by that is identify which of those investors actually have any track record.
That's
so
right.
I sat through too many competitions, be they other type of sort of official pitching situations where the panel of decision makers fundamentally don't understand the sector. So you can tell that very quickly from the sort of questions you're getting, which is eventually you get to the point where, okay, we're looking at this as an e-commerce play rather than. Your best bet is, as the entrepreneur, is to see that as a lesson, as a learning ground, as a way of answering the right interview questions, so that when you really are facing the investor who understands the space and has done their homework in relation to your market space, your product, then you've got the right answers for them. But it's certainly a case of you as the entrepreneur doing your homework in understanding which of the investors you should be targeting versus pitching to the whole planet, because a lot of them may show interest out of sheer scientific curiosity, but don't necessarily understand what you're bringing to them, and you're going to chew up a lot of time educating them, with probably not getting an investment decision simply because you're outside their zone of comfort.
That's right.
But I mean, you guys probably have. You probably spend a lot of time educating.
Yeah, Nawal, Nawal spent a lot of time educating me. So how's your experience like?
And she still has not invested in us, so that tells you everything. See, I have seen the full spectrum. People who have seen the sector have done the homework. They write the check first and then do the full due diligence. Okay. Whereas I have also seen the discussion where they ask me, why should I give you $1 million when I can buy the apartment? I tell them you should buy the apartment, but the max you'll make is 3x in 30 years. whereas the probability that you succeed, you can make 20x in 5 years. And hence, there is a real economic answer to that question, the way they are discussing. But having said that, I mean, we have done 3 rounds of fundraising, and so I have gone through the full gamut of raising some serious amount of money. By the time, as we speak, I'm raising the 3rd round, and I'll probably close, by this month. It is a hard job, but at the same time, I personally love the process. It's extremely humbling, and most of the time, answering to every smart and dumb question that comes in my way makes me think again and again and again in terms of narrative, in terms of storytelling, what's missing, what are they really adding. What I look for always is that person able to write the check, and the second, how fast they can do. Okay, if they're dragging on both, I'm out. I'm out faster than you can imagine, and then I move on.
Great. So I just want to sort of open the floor now for a few questions. Yes, a gentleman at the back, please. So can we have a mic? Thank you.
While we're travelling the mic across, just to reflect on that very quickly.
Yeah.
Alongside my investment activities, I co-founded an organisation called Galen Growth Asia, which you see up above next to my name. That is purely an industry-sponsored platform focused on creating an integrated network and health tech innovators. One of the things we realized very quickly last year is the fact that you can try and help the entrepreneur understand better, but we had to educate the investor.
Yes,
and
it works both ways.
Correct. So we this year at Galen Growth Asia are putting a huge focus on that, which is culminating in November with a Health Tech Investor Summit on the 16th of November, where we are really going to regroup the community of investors of the region in one place and walk through case studies of investments in health tech businesses so that they have a chance to understand the decision-making criteria, but also to ask questions, of course, so that they get more comfortable with it. Because unless we get them comfortable, the job of the entrepreneur continues to be a nightmare.
That's right.
Sorry.
Thank you, Julien, for that.
Question. Thanks for some really good insights. Question for Julien and Nawal. Would you consider heuristics plus natural supplements or natural ingredients-based biohacking as hence health tech, potentially through software in the mix? Case in point, I have a friend who started a company that's now venture-backed. He traveled in the Himalayas in Tibet. He observed that monks were feeling really good by putting yak butter into tea. And on that basis, he started his whole company, and it's really venture-backed and doing really well. So my question is, that's just a outlier, but do you think like biohacking plus heuristics, we're not talking AI, it's just rules, your grandma's recipes, like for example, blueberries are known to reduce blood pressure, so there's many of these out there. Do you think that might result in a health tech company? Would that be qualification for health tech?
I think the safest answer is maybe. I mean, we really don't know, but the simple answer is no. Yeah.
I tend to echo what I just heard from Nawal, but it could be because I'm somewhat coloured by my own pedigree, which is working in healthcare for many years. And what I mean by that is scientific evidence tends to drive a decision and does so for the majority of the population. So although there are no doubt understood properties and benefits for some of the foods you're talking about, and we continue to hear about superfoods and et cetera, I think it'll still take a little while for us to move from early adopter to the majority of the population adopting that. I mean, it's very hard to get people to even worry about what they're eating full stop, let alone really focusing on certain foods versus other foods. So I think it's still the maybe box, but we're some time away from seeing, a unicorn come out of it, let's say.
I mean, the reality is, we can't fight science, and the reason should not be to fight science, And so there could be all the element of quackery, I mean, if it is pure quackery, then, let's ignore it. Let's not give them that stuff.
Yeah, I debate the term quackery because there's a science behind it. It's just that we haven't discovered that, discovered the, the hypothesis and proving the hypothesis.
Yeah.
Sure. Thank you. Do we have any other questions? We've got another gentleman over there.
One there, one over there.
Test. Hi, my name is Colin. I'm a medical doctor. So quite often I've got companies coming to me and they've asked me, I've got this product. They are looking for advice how to integrate the product, implement it. they've got good ideas, but the question always is how to bring it to the ground in the market. Very relevant to what Gillian was talking about, breaking through the market, as well as what Julien was talking about earlier, the difference between a medtech and a biotech company, where a lot of the technologies are top-down driven from professionals, from doctors, from scientists. Healthcare is very often driven by entrepreneurs as well as engineers and technicians. So the question is, what's your experience for all three of you in terms of breaking into the markets? Do you think that you need that sort of medical expertise right at the early stage when you're conceptualizing your ideas and your technologies, or do you think the doctor can come in later, number one? And then secondly, what are the barriers and how do you think you can overcome those barriers? Because very often in healthcare, I see a lot of these technologies, what they're essentially trying to do is replace the pharmacist or the dietitian and the nutritionist and bring that to the home and bring that to the patient's pocket. But in the real world, very often what happens is that you need the doctor to say, hey, I refer you to the physiotherapist or the dietitian. And therefore, without that doctor saying, hey, go check out this product because this product is a replacement for the pharmacist or nutritionist. A lot of these companies have a good product, but they find it very hard to break into that market. So do you have any ideas of what are the difficulties you faced, and then how do you overcome them? How have you overcome them with
Gillian, you want to take a stab at that first?
Sure. So I think it's not an either-or question. I think the question is not, is this more important than the other? Is the question, and that we grapple with a lot is what's the best way to integrate between a clinical team with the other parts of an organization, particularly a technology focused one. So, we deal with that. I think my co-founder, Lily in the audience today, and I, we grapple with that a lot. So we have in Homage a clinical, what we call a clinical care operations team. And everyone on that team has a minimum of 10 years of experience, clinical experience at a hospital. That's really important, particularly, I think, vis-a-vis the service or product that you're solving. Again, I think it comes down to the fundamentals. What kinds of needs are you meeting in terms of the families or the people that you work with? When you bridge that with understanding, again, what components are clinical versus what are not, and then understanding the regulatory requirements for each one, how does that tie into a lot of the concepts that we now know, that's commonplace in technology startups. So things like performance marketing, inside sales, customer success, right? And that a lot of these sort of new novel concepts that actually were imported from the Silicon Valley. How do you merge that with, again, a very local context, a very different healthcare system specific to Singapore, with the group of private hospitals, community hospitals, public organizations that are subvented. How does the money flow? What does the public domain look like? What does the subsidization levels look like? So it gets very granular in terms of the nuts and bolts of what happens on the ground. But it's in terms of distribution, I think that's the way you have to look at it, which is, we didn't productize a lot of what we did up front. We literally spent most of the first year of our operations just learning what worked in terms of services that our families needed. What were the clinical components? How does this, what is metal transfer? All of that, right? So, and then we started to productize. I think for tech startups in healthcare, the pitfall is building a tool that you conceptually know that it's a good idea because the market's big. The industry is moving that way. But when you launch, it doesn't quite fit with what how people are using it or what they're doing with it. So
Sure.
I see that time and again.
I think just to interject a little bit, I think back to your question about how do we think about breaking into the market. I think this is probably touching on the less obvious parts of the business for health tech, and that is I think that sort of a bigger question of whether it's a B2B model you're looking at or B2C model, and that I think has a bearing on how that market would look like, and hence how you break into it. Nawal, do you want to just comment on that quickly? Just give me
Absolutely.
experience at
So
Homage.
I would say the clinicians becomes, from a tech company, the clinicians become a subset of your skill set. As you need technology, as you need data science, as you need design, clinicians are also a subset of your department and the skill group. An entrepreneur doesn't need to be a clinician to really go to the distribution. Most importantly, in healthcare, most of the distribution channel is B2B2C. And that B doesn't need to be a hospital or doesn't need to be a doctor. That B can be an insurance company, it can be an employer, it can be a pharmaceutical company, and across the whole spectrum of the stakeholder in the healthcare group. And that is where there is a mental bias that it has to go through a clinician channel. That clinician channel can be supported by other channels of within the B2B2C spectrum. So that's the way I would look at it. Breaking into the market is always the hard job, and none of us really know the answer. But at the same time, we are literally a step by step trying to fix on it. And the intent is to keep trying to fixing, as Gillian is saying, that you try to figure out what works, what is needed, and then go deeper from that perspective. Does that?
Great. Julien, any last comments? We're actually running out of time.
I realise that.
Yeah.
The only thing I would say is don't forget the importance of trust. So, there's a lot of fintech excitement out there. There's a reason why we still use banks and don't go to the nearest fintech companies, because we only really trust the bank to hold on to our money in a safe way. It's not too far away from, you can spend a lot of money on UI, UX, and all the other exciting things. Yes, the clinicians will help you with design. But remember, trust also plays a massive, important, variable, that's the word I'm looking for, in whether your product will get adopted and used. And does the healthcare professional play a role in that? Yes, but of course it depends on the product as well.
Sure. I think it just comes down to healthcare being an age-old practice, and it requires some behavioral change actually within this sector in order for some of these technologies or concepts to be adopted. So thank you so very much for our fantastic panel today, and also for our audience. If you have further questions, please feel free to come up to any one of us to engage us after the session. Thank you. Thank you, everyone.
Can you have a big round of applause for Carolyn?
Yes.
Thank you, folks. All right, next up, we have another panel. So, how Malaysia and